Hello, my name is LOUISSA Christine LAKISAN, and for this special study module, I will be presenting about the heart. So, we will start with the location of the heart. So, the heart rests on the diaphragm, which is near the midline of the thoracic cavity. So, it lies in the mediastinum, which extends from the sternum to the vertebral column, which is from the first rib to the diaphragm between the lungs. And about 2/3 of the mass of the heart lies to the left of the body's midline. Now, the heart shape is trapezoidal, so the pointed apex is formed by the left ventricle and rests on the diaphragm. It is directed anteriorly, inferiorly, and to the left. So the base of the heart is its posterior surface. It is formed by the atria, which is the upper chambers of the heart, and mostly by the left atrium. So separating the surface of the heart are its borders. So there are four main borders of the heart, which is the right border, the inferior border, left border, and the superior border. So the membrane that surrounds and protects the heart is what we call as the pericardium. The pericardium consists of two main parts, which is the fibrous pericardium and the serous pericardium. The inner visceral layer of the serous pericardium, which also called as the epicardium, is one of the layers of the heart wall and adheres tightly to the surface of the heart. Now, the wall of the heart consists of three layers, which is the epicardium, the myocardium, and the endocardium. Note that the myocardium is the thickest among the three layers because the myocardium are responsible for the pumping action of the heart and is composed of cardiac muscle tissue, which makes up approximately 95% of the heart wall. Now, the heart has four chambers. So the two superior receiving chambers are what we call as the atria, and the two inferior pumping chambers are the ventricles. So you look at this here is that the atria, which is the right atrium and then the left atrium, and then the ventricles separated to the right ventricle and left ventricle. And so the left side of the heart receive oxygenated blood, while the right side of the heart receive deoxygenated blood. So what separates between these chambers is what we call as the septum. Now, between the right atrium and the left atrium is the interatrial septum, and between the right and the left ventricle is the interventricular septum. And between the atrium and the ventricle is what we call as the atrioventricular septum. Now, the structure that we see here, which appears like a door shape, like, is what we call as the valves of the heart. So the valves of the heart is divided into two, which is the atrioventricular valves and the semilunar valve. So the atrioventricular valve is located between the atrium and the ventricles, meanwhile the semilunar valves is located between the ventricles and the great vessels. So the atrioventricular valve for the left side, we have the bicuspid or mitral valve, and then for the right side we have the tricuspid valve, and then the semilunar valve at the right side we have the pulmonary valve, and then at the left side we have the aortic valve. Now moving on to the myocardial thickness and function. So for the atria, it's thin wall because it delivers blood into the adjacent ventricles under lower pressure. And meanwhile, the ventricles have thicker walls, but as it pumps blood over greater distance with higher pressure. But as we see, although the right and the left ventricles act as two separate pumps that simultaneously ejects equal volumes of blood, the right side has much smaller workload, so it pumps blood a short distance to the lungs at lower pressure, and the resistance to blood flow is small. Then the left ventricle pumps blood at greater distance to all other parts of the body at higher temperature. So the resistance to blood flow is much more larger. So therefore, the left ventricle works much harder than the right ventricle to maintain the same rate of blood flow. Now moving on to the conducting system of the heart. So the structure of the conducting system consists of the sinoatrial as a node, and then after that the atrioventricular AV node, and then there's a bundle of his which located at the interventricular septum, and then after that we have the Purkinje fibers. A cardiac cycle, the pressure within the chambers rises and falls. So when the atria contract, the ventricles relax. And then when the ventricles contract, the atria are then relaxed. And then there's a period of time when the atria and the ventricles both relax for a brief interval. Cardiac cycle begins when the ventricular pressure is low, so the pressure difference between the atria and the ventricles opens the AV valves. So 70% of the blood enters the ventricles before atrial contraction. So the remaining 30% of the blood is pushed into the ventricles by atrial contraction. And then what happens is that the ventricular pressure increases slightly. And after that, the ventricular pressure will then rise sharply. And this is when the ventricular pressure exceeds the atrial pressure, then the AV valve is closed. So when this happens, the papillary muscles contracts, which prevent the AV valve cups from bulging into the atria. Then during the ventricular contraction, the atria are relaxed and then the pressure is low. So the blood will flow into the atria from the veins, preparing for the next cycle. And after that, the ventricular pressure will increase and exceeds the pressure in the pulmonary trunk and the aorta. So the semilunar valves, which is the pulmonary and the aortic at both sides, will open and then eject the blood into these arteries. So the ventricular pressure will then drop as the ventricles relax. So when the ventricular pressure is lower than aortic or pulmonary pressure, the semilunar valves close. So as the ventricular pressure drops below atrial pressure, the AV valves will then reopen. So the ventricles begin filling again while both atria and ventricles are relaxed for a brief moment. So this process represents the flow of blood through the heart during one cardiac cycle. So a heartbeat is heard through a stethoscope, sounds like doop doop. So these sounds are due to the vibrations in the heart tissues produced as the blood flow is suddenly speeded or slowed with the contraction and the relaxation of the heart chambers, and with the opening and closing of the valves. So the first sound, which can be described as a loop sound, is louder and a bit longer than the second sound. So S1, which is the sound one, is caused by blood turbulence associated with closure of the AV valves soon after ventricular systole begins. So, and then the second sound, which is shorter and not as loud as the first, can be described as a doop sound. So the second sound is caused by blood turbulence associated with closure of the SL valves at the beginning of ventricular diastole. Now moving on to the heart-related disease. One of the heart-related disease, which is the mitral valve regurgitation. So mitral valve regurgitation is a heart valve condition in which the flaps of the mitral valve does not close properly. So this causes a backward flow of the blood back to the heart. So the flaps of the mitral valve, also called as the valve leaflets or cusp, control the flow of the blood from the left atrium to the ventricle through the valve. So if not closed tightly or if the valve size and the shape are altered, the blood may leak in the wrong direction. So this leak is also referred to as mitral regurgitation or mitral valve insufficiency and is the most common form of heart valve disease. Heart valve disease is staged into four basic groups. which is stage A, stage B, stage C, and stage D. And the stage A at first is at risk, which is the risk factors for heart valve disease are present. And then moving on to the stage B, which is the progressive stage. And this is where the valve disease is mild or moderate. There are no heart valve symptoms. And then after that, stage C, which is the asymptomatic severe stage. There are no heart valve symptoms, but the valve disease is severe. And then the last stage, which is the stage D, and this is the symptomatic severe stage. And this is when the heart valve disease is severe and is causing symptoms. So among the common tests that we could use to diagnose mitral valve regurgitation is, for example, echocardiogram, electrocardiogram, chest X-ray, and cardiac MRI. Now, to treat mitral regurgitation, one of the ways is we could do some changes in lifestyle, in our daily lifestyle, and then we could also do some regular health checkups. And then we could also give medicines to treat symptoms and prevent complications such as blood clots. So the types of medicines that may be used for mitral valve regurgitation includes water pills, which is also called as diuretics. Now, this medicine reduces or prevents fluid buildup in the lungs and other parts of the body. And other examples of medicines, which is blood thinners, also called as anticoagulants. Now, and after that, the treatment that could be done is by doing surgery to repair or replace the mitral valve. So a diseased or damaged mitral valve might eventually need to be repaired or replaced. So even if you don't have any symptoms, you need to undergo surgery. So surgery for mitral valve disease includes mitral valve repair and mitral valve replacement. Before I end my slideshow, I want to share with you the specialist in my field of interest. So, Dr. Emily Tan Lek Kun is a highly respected consultant cardiologist and specialist at the Institut Jantung Negara in Malaysia. She is well known for her expertise in adult cardiology, with a focus on heart disease management and preventive care. So, Dr. Tan has extensive experience in diagnosing and treating a range of cardiovascular conditions, from hypertension and coronary artery disease to more complex heart conditions. That is all from me. Thank you.